Hi guys, just carrying on from my CPD last week. Because it was off the cuff and I hadn't had it scripted or I didn't have a clear agenda or anything like that. I wanted to some things were going through my head all week, and I was like, oh, Mister didn't talk about that. So many things to talk about. So just some really I think these are some really important points, and they're in no particular order necessarily. I was just kind of jotting them down, and I just wanted to get it out because I'm very OCD. I like to make sure everything's covered. And I just want to share some tips about some things I do in my clinic that are very useful. Understanding the patient's last visit is very important. When was the last time they saw their last dentist? What was it for? Was it in the same practice? Was it in a different practice? Was it local or interstate? Was it public? If it was private, whereabouts was it private? Was it preferred provider? Is the practice they went to, do they charge high fees, low fees? And it's important in understanding what their expectations are on price as well. So yeah, their last visit's paramount, really important. And another thing as well is if you're busy with, if you take clinical photos and show the patient, it's really important to show the patient. Don't make them trust you, let them verify for themselves. If you're time poor, you can just get them to hold a handheld mirror and just with your loop, because I always wear loop lights or overhead lights. So I find the overhead light quite tedious, is you just get them to hold it, and if you show them in their mouth using your dental mirror, just reflect if it's palatally or something like that, they can see it quickly and easily. It's really important to show the patient, especially in the first visits. Like if it's the patient's first time and you're doing a procedure on them, especially at the first time, show them before, during, and afters. And that'll be a real way. And another thing you can do as well is print off the before, during, and afters on a nice letterhead. Give it to them to take home, print off, put it on their kitchen table, and they can show their family and friends. I went to X dental practice. Look how good the job was. They're sitting there having a beer or a barbecue, and they're showing. And patients, might like that. It's a great way to build the practice. Another tip as well. Sorry, I got a cough. If patients have complex medical histories and you want to make sure, sometimes they can forget, you can get them to go to their pharmacy and get a meds check, get a printed list of medications to bring in. It's also really handy to have the TG book with you, Therapeutic Guidelines book. It's a great reference tool and handles probably 90% of the dental issues that we have. Another thing as well, when I do cleanings, I'm very careful about digging the mirror into their gums and always watching the assistant to make sure they're not digging and yanking on the gums. Patients can find it very uncomfortable. One thing I do is I'll flip the mirror around and just have the long end to retract very gently. And sometimes around the lip, I'll lift it up with my finger as well. Some real nice touches, and always adjusting the ultrasonic to make sure it's not too sensitive for their teeth. If they are jumping and they got heaps of calculus, you really should have diagnosed it before and said, look, do you get sensitive teeth? You need your car serviced regularly, but occasionally your car needs a major service. I recommend a thorough local anaesthetic if you want to keep your teeth as long as possible. If someone comes in pain, they say, how are you going? Say, good. Don't ask, if a patient's in pain, try not to ask them how they're going. Say, I'd ask you how you're, or this is what I do. I say, well, I'd ask you how you're going, but I try not to ask silly questions, and you usually get a laugh out of it. When patients come in and sit in the chair, say things like, just make yourself comfortable on the chair there. Would you like a drink of water while you're waiting? If there's someone with them, you like a drink of water while you're waiting? Is the room temperature okay for you? Most of the time they'll say it's okay, but it just shows that, real nice touch. Another thing I try to have as well is all the consent forms in like a folder, like a pigeonhole style setup, and then you can always just take out consent forms and give them to patients, easy to identify and grab, and allow the patients to self-educate, especially if they're asking lots of questions or anything like that. Trying to give them as much information as possible, and say, look, read up, do your own, feel free to do your own research, here's some information. You're giving them the information, but you're letting them educate themselves. Now as well, a lot of the difficulties you can have with patients are usually in the first visit, like, I just want to clean. I don't want x-rays. It's always due to the cost. So, with x-rays, once again, when was the last time they had x-rays? Um, and you can have like a little ADA guidelines thing up on the wall. And you can say, if you want to point to it, I don't point to it. I say, look, the current guidelines is every 2 years. We like to take x-rays. You're a new patient, so I'd like to start comprehensively and assess everything. And that includes looking between your teeth. I can see the outsides of your teeth, but I can't see between your teeth. Sometimes there's holes that can be missed. I like to check the levels of the gums as well, and you've got a lot of fillings back there if they've got fillings. I like to check underneath the fillings just to make sure all the fillings are okay. And occasionally, if you can see that their finances are an issue, say, look, I've done the clean today and everything like that. We can take the scans today if you want. We can take them in a month's time, or we can take them at your next 6 monthly checkup. You can take them in June when you come in for your next cleaning of the gums. What would you like to do? You take them in a month or 1 to 6 months, or you just give them a couple of options. Try and always give patients two options is always good, and try and just keep the options simple. They've got irreversible pop-eyes. You've got two options. You can either take the tooth out or save the tooth. And you just go, You don't need to go through all the risks and stuff. You go through all the minor risks later after they've made a decision, but try and keep the options real simple. And as well, keep the fees separate as well. It's a dance, it's a conversation, it's a negotiation. So I tend to talk about the treatment and talk about the fees separately. But giving them a ballpark can give them an idea of whether something's completely out of their price range or not, or what their goals are. Broken teeth, you can also provide the option, we can either patch a tooth up, which just fills up the hole, doesn't make the tooth stronger. And what I've been doing lately is I say, patch the tooth up. And if the tooth's got a big hole restoration or something like that, and it's the rest of it's weak, I say, we can patch a tooth up. And then if you're not getting any issues, I recommend in a month. If you want to keep the tooth as long as possible, we could cover over a tooth, a crown. Another option is you can do somewhere in the middle. Patching the tooth up just fills the hole. Crown's the more expensive option. If you kind of want something in the middle, we can reduce the height of the tooth by 1.5 to 2 millimeters. Put a cover over it to make the whole top stronger. So when you're biting down on it, the tooth's not flexing and wedging apart. But it won't last forever and long, But it might give you a year or two. And then later down the track, we can put a crown over that. If you want to keep the tooth as long as possible, we can just put a cover over it and you can just see how you go. It's up to you. The patch is $350. Overlay 650, crown 1750, or $2,500, or whatever. And sometimes I say to patients, look, nothing in dentistry lasts forever. It will need to be maintained, particularly anteriors and stuff. It will need to be maintained over time. It's really important you're having your teeth checked every 6 months and having everything checked to make sure everything's nice and stable. And when I do anterior restoration and stuff, right inside the ledges, especially with deep bites and that. I don't do many. Oh no, I'd still do a little bit of resin towards the front, especially if it's an emergency presentation. But I'll say, the harder the foods you chew, the more likely it is to break. I can't, and you say with any kind of procedure, I can't make any guarantees. All we can guarantee is that we do our best, and we can't ask for much more than that. And patients will always say, "Oh, we can't ask for much more than that." And when talking about a splint, an analogy for using a splint is say, especially if they've got TMG issues, like whatever, if you want, you can try some, Nurofen, some heat packs, minimize yawning, soft foods. But, if you want, we can consider, because I'll always start with the least first, the least invasive first, I think is always a really good philosophy. And when you tell patients that, I like to keep things simple, less is best. Man, they respect it so much. Because they know you're not just trying to push them for the most expensive treatment option. You'll get the most expensive treatment option in due course, but not everyone's ready for that yet. So just take your time, slow and long-term treatment planning. When talking about a splint, say something like, you could wear like a little protective guard for your teeth. It's called a splint. It's kind of like crutches for your jaw joint. Just allows the bottom teeth to not interlock and just lets the bottom jaw reset. It's like crutches for your jaw joint. You know, there's some options there. So there's some things I wanted to cover there. I'm going to do a separate video now just on infection control for all staff as well. But dental and non-dental should be listening to this too. You know, because it's all about the non-dental staff will always communicate how they hear you communicate as well. So if we're all on the kind of same wavelength, and you'll have your own flair and you'll have your own things that you say, which is great. But remember, the non-dental staff will always tend to, you know, they look to what, you know, you do. So, yeah, it's nice when everyone's on the same page.